Yes, Hans Berger is the correct answer. So next question, ready, Team D? Next question to you is, you have to answer the question, what is the meaning of the term synchronization, desynchronization? And your timer starts now. Synchronization and desynchronization. Time is up. This is very common fact which is given in your books. Synchronization and desynchronization, because of which you will get various waves. Any other team can answer, but I will not give you any marks for it. Yes, Kalyani, you want to answer? So they have told almost correctly. So meaning of synchronization and desynchronization is neural activity working in same direction is synchronization, and during mental activity desynchronization occur which produce irregular low voltage activity. So that is known as synchronization and desynchronization. It is given in almost all physiology. So there are certain interesting, or you can say disturbing facts about Hans Berger. He first recorded electrical activity of the human brain from the surface of air. There are various controversial things in literature about his relationship with the Nazis. He was psychiatrist by profession, but still he has faced with the clinical depression and he has committed suicide in 1941. So there were some tragic facts about it. So team E, are you ready? So this is your master and you have to identify. Your timer starts now.
Say flu.
Zero. Flu. Zero for previous step. It was not for. So your timer is, your clue is, this. He has described the syndrome which involved hemisection of spinal cord, and your timer starts now.
Say Brown sequel.
Okay. So they have answered correctly. So +5 for it. You can give +5. So his complete name is Charles Edward Brown Scott, and he is single scientist or many scientists are there in this name? Anybody? It is single or many? Pair. What do you think, pair or single? He is single. Only one scientist. Okay. So your question, second sub question ready? Enumerate sensory symptoms seen on right side below the level of lesion. I am very specific, one segment below in right side hemisection of the spinal cord. Your timer has started.
So on the right side, there will be disruption of the dorsal column. So there will be loss of fine touch proprioception.
On right side there is a loss of
fine touch proprioception.
Fine touch and proprioception. We will see whether your answer is correct or not. So laws of position, you have told proprioception and you have told time. So we will give full marks to them. Plus 10. I think we are having some faculties from other college. If we, acha, parents. So still we welcome you for the quiz. So Charles Edward Brown-Sequard was one scientist. His other contribution was he demonstrated that removal of adrenal gland leads to death. Thus, adrenal gland was essential for life. He was one of the first to postulate that existence of substance known as hormones. He also studied function of sympathetic nerves, and there is one fluid, that is Brown-Sequard elixir, which is named after him. Fluid prepared from the testicles of guinea pig and dogs that lead to regeneration and prolonged human life. So this was some of the interesting facts of our contribution about the scientist Brown-Sequard. So let us see. You can tell.
So at the end of round 1, we have the leading team as AIMS Rishikesh team 1 and AIMS Kalyani with 15 points each. Next we have BGMC Pune with 5 points, and GMC Surat and AIMS Rishikesh team 2 haven't started their accounts.
Don't worry, there are sufficient rounds are there. Audience ready? Main event participant can rest. So all of you know how to play this. At one time 40 players can participate. So be ready with your mobiles. Pin will load anytime pin is loaded. Till 15, there is a scope for 13. Still 8s are remaining. 34. Medal is there, okay? For audience, medal is there, as well as you are going to get certificate also. Start. 40. Question number 1 only. 3 questions are there. Last question. ABD is leading. Whoever is ABD? He is not ABD leading. Varun sir to give him medal and certificate.
What's your name, ABD?
Sir, sir. Varun sir. Sir.
Okay, so team E ready now? We will start. We are going to start with you now. E, D, C, B, A. After this, quiz master will change. So we will be starting with the round known as recent advances. So I am sure that once you have heard this recent advances round, you must be afraid. At least in my PG syllabus, there were syllabus recent advances. So I was very worried about that because so many things are recent. So but here don't worry, we are going to tell you recent things and we are going to ask you question from your related physiology only. We are not going to ask you any recent things. We are just telling you as well as audience what are the various recent things which are available. Okay. I welcome Dr. Bala sir, our Dean Student Welfare. I would request Wakode sir to welcome by a flower. Bala sir is HOD Pharmacology. Their department also conduct quizzes which are excellent. Means you can enjoy their quiz. You can come again to participate in pharmacology quiz. So team E ready? So again, there are general rules. We will be telling some pictures will be displayed and interesting fact will be told. There will be 20. Now here see 5 marks. There is no 5 marks now. Either it is 10 or 0. For 2 sub question it is 10 or 0. If you are unable to answer first sub question, then answer would be given if it is related. Otherwise we will discuss answer in the end only. So 30 seconds. Again here 30 seconds for each question. Each sub question. There is no negative marking. There is no passing. So let us start. So team E, what it is? It is not your question, don't worry. Why this picture is displayed? Sense organ. Okay. So there is one field known as regenerative medicine. Regenerative medicine has transformed the treatment of many diseases. One of the forms of regenerative medicine is tissue engineering. Tissue engineering is being developed to replace damaged or diseased organ using 3D printing such as liver, pancreas, heart, anatomical models and various implants. But still there are many challenges, and one of the challenges is the acceptance by immune mechanism. So this is one of the interesting facts which all of you can be aware. So your question is, ready for question? When we consider the development of immunity, immune cell undergo various process. So in this process there is one process known as negative selection. So your question is, what is negative selection? Your timer starts now.
Sir, those cells which act with the cells of our own body, which are self-reactive, they are destroyed by apoptosis or they are made inactive.
So this is correct answer. I can give them plus 10. Which is plus 10. So second question for you is, which type of immunoglobulin is increased in allergic disorder? Name heavy chain present in this type of immunoglobulin. Your timer has already started.
Sir, IgE is increased and the heavy chain which is present is epsilon.
Yes, correct answer. So you get plus 10, so 10 plus 10, 20. So I think we will not discuss answer. All of you know the answers. My sound is not coming.
अभी आ रहा है, अब आ रहा है. लैपटॉप इधर है.
Actually, it is far away. So team D. मुझे
एक के बाद तीन.
टीम डी. हाँ ऐसे जा रहे हैं. आ रही. Okay. So you are. So can you tell me what it is, team D? Don't worry again. This is not your question. Any guess? So this is a wearable artificial kidney. So wearable artificial kidney has a promise for enhancing the quality of life for individual which end stage renal disease. There is one device is known as WAK TM device which weighs less than 10 pounds, around 4.5 kg, and it operates on 9-volt batteries and uses less than 400 ml of fluid. Means you can carry and it will be very useful for end stage renal disease. So question related to this is, team D ready? When the role of vasa recta is considered, it acts as a counter exchanger. In which direction does NaCl diffuse in the ascending and descending limb of Henle? Ascending and descending limb of vessels. Your timer starts now. One member can write also answer.
Sir, in the descending limb of vasa recta, NaCl diffuses in, and the opposite in the ascending limb where NaCl comes in.
So your answer is ascending limb, NaCl diffuse in, and okay. Ascending limb, NaCl is diffusing out, and descending limb, NaCl is diffusing in. So we will check whether answer is correct or not. So before that we will just see question 2, then we will come back to question 1. How does urea play a role in counter current mechanism? Your timer has started.
Urea increases the osmolarity of the renal medulla.
That is one, but you have to be specific. You have to be specific. Your question is very specific.
So that way it helps in water reabsorption.
No, not specific.
How does?
Still,
See the question. How does?
the time is up. Still you can answer, but for that you will not get mark. There were certain keywords. You have to use recirculation of urea. Urea is no doubt is increasing osmolarity, but how that recirculation is very important. So for that I can't give you marks. So NaCl and urea diffuses out of ascending limb of the vessel and it diffuses into the descending limb. So you have answered same. So plus 10 for the, but for this you don't get any mark. It is recirculation of urea which play important role. This is one of the diagram. This is one of the diagram from Guyton. Just see some portion is very thick. So from that urea doesn't come out. It goes out in the inner medulla. So that answer was expected. So plus 10, okay? 10 plus 0. Team C ready? This is your question. What it is?
Wild guess, but Neuralink?
This is
Neuralink?
Neuralink. Neuralink means something
It's
related.
a company run by Elon Musk about brain chips.
Okay, you don't get any marks for it because this is not your question. So you are correct. So it is a form of artificial intelligence. Artificial intelligence system can evaluate enormous amount of medical data including images, test results, and patient record. This may result in more accurate diagnosis, individualized treatment strategies, and effective patient monitoring. There are various AI or artificial intelligence based algorithms are also there which are used for interpretation of various investigations. So something interpretation also can be done with the help of AI. So your question is, all of you know there is one of the basic investigation which you do in undergraduate laboratory. So that is spirometry. In spirometry, especially compressed spirometry, result is coming as normal, obstructive, restrictive. So when does doctor or software say that results are normal based on absolute values of FVC and FEV1 in Indian males? I hope question is clear. See, whatever FVC and FEV1 value is coming, software will tell automatically whether it is normal, abnormal, and for that there is certain criteria is there. So you have to tell what are these normal values. Indian male, gender is specific and ethnicity is also specific. Your timer has started already.
Like we put in like whether the person smokes, whether they are male or female, their ethnicity, everything into the
You are
software.
not reading question properly.
Absolute values.
This very clearly mention absolute value. Still you are wasting your time. Why smoker, everything? Absolute values. Still you can answer, but for that you will not get any mark. What are the normal values of FVC in males?
Normal values. Absolute values.
Okay, second question. Okay, it is 4 liters. And FEV1, it is around 80% of 4 liters, so you can take around 3.2, 3.3. So your second question ready? So please read it properly, okay? What is the importance of functional residual capacity? Your timer is starting now.
The respiration remains continued, the lungs never remains empty.
Okay, one other.
Normal functioning of the lungs.
No, you have to tell only this much is not enough. You have to explain that properly. Your time is up. I am afraid, I think you can't give marks because they have answered very brief.
You can continue. In continuation, you want to add?
No, but you can add, but you will not get because time is up.
टाइम तो पहले स्टार्ट किया ना, तो they can continue.
But they are taking a long pause.
All this now.
So we will go to answer. So first was this FVC 3.5 to 4 liters and FEV1 should be more than 80%. And importance of functional residual capacity. Audience, can you tell? Audience? एक तो उन्होंने प्रोलैप्स वगैरह बताया और कुछ? See, main thing was it is acting as a buffer. It prevents sudden changes, excessive increase or decrease in tissue oxygenation. Not only tissue oxygenation, CO2 concentration, CO2 pH. So that much complete answer was expected from. So for this you are getting 0 plus 0. For 2 questions. So team B, ready? Mic. So there is nothing to be identification here, everything is mentioned there. So what it is? It is about nanotechnology and application of nanotechnology. So the question is, first we will discuss about interesting fact, then we will go to question. Nanoparticles can be delivered directly at the site, thus targeting disease cell or tissue. This technology may improve the efficacy of therapies and lessen their adverse effect and potentially enable the treatment of previously incurable disease. These would be very useful in cancer patients where huge morbidity is as a result of drugs. You know, cancer patient is having various side effects. So when you are giving it orally, they along with the site, other normal site also get damaged. So nanoparticle can prevent this. So your question is, there is one phenomenon known as first pass effect. First pass effect is a pharmacological phenomenon whereby drugs undergo metabolism before it reaches the target. The major site of this first pass metabolism is liver. In addition to this liver has various other roles to play. Your question is, what does hepatic glucostat means and how does it occurs? Your timer has started.
So, sir, when there is an increased intake or a load of glucose is coming through, due to the first pass effect, the load will first go to the liver, where it will be, most of it will be taken in so as to maintain the levels of the blood. This is aided by various modifications like the presence of glucokinase in the liver, which allows the glucose to get inside for as long as the level is high. Also, with the effects of the various hormones like insulin, glucagon, it will, in case the glucose levels is dropping, it will induce glycogenolysis, gluconeogenesis to produce and put the glucose into the bloodstream to normalize the levels again.
They have told correctly, so we can give plus 10 for this answer. So plus 10 for first sub question. So question 2 is, what is enterohepatic circulation? Explain its role concerning with the fat absorption. Your timer starts now.
Sir, so in case of fat absorption, the liver is secreting the bile salts, basically the bile into the intestine. This will produce the emulsification action and help in the preliminary digestion of the fats. The absorption will take place in the form of chylomicrons, and it will again, according to
Still
the
answer
first
is
part,
incomplete.
according to first part, it will travel to the liver. So this will allow the bile, basically the bile pigment.
Answer part, you have not answered what is enterohepatic circulation.
First to answer, you have to answer first.
Don't take pause, fast.
So the enterohepatic circulation is basically the circulation that takes place from the intestine to the liver and back from the liver to the intestine, which is in the form of bile pigment.
How much percentage get absorbed?
Speak correctly. Is it bile pigment?
So bile pigments are mainly meant to be excreted, but they are also slightly absorbed. But mainly it is related to the bile salts which help in the fat absorption.
So how much get absorbed? In enterohepatic circulation, how much is getting recirculated? Around percentage. Still, I think we should give them plus 10. Around more than 90% get circulated. Okay? And other almost they have answered correctly. So here you get 10 plus 10. So this was hepatic glucostat which they have explained. And enterohepatic circulation, they have told how this is one of the way by which enterohepatic circulation is occurring. Majority of the bile salts are getting absorbed. So now last team A. Ready? So can you tell me what it is? Huh? What?
Use of Vision Pro.
Use of
Vision Pro.
Vision Pro means? VRX, right. So this is what? It is a virtual reality. by virtual reality, medical students can practice skills in a safe and controlled environment. Students can practice medical procedures and various scenarios can be given to them. This VR technology can replace animals as well as cadaveric models in training for less common medical operation. So this is the use of technology known as virtual reality. So your question related to this is, when somebody acquires these skills through repeated practice, learning happens. So what is this form of memory is called? Your timer has started.
Sir, this is long-term potentiation, conversion of short-term memory into long-term memory.
Wrong. You have to be specific because you have not been asked about mechanism. So for this we can't give you marks because this was indirectly clue, because once you have told this then you have go to next, you can answer next. So for that you will not get answer. You have to tell very specific which type of memory is it. You have not asked about mechanism.
Again, to the all participants I am telling, you are not reading the question properly. Read the question twice. It's clearly mentioned there. Skills. Please, in next rounds, all of you read the question carefully and then answer.
30 seconds is sufficient time. You can take complete time, and once around at the end of 4-5 seconds also you have started answer, you will wait. It is not that in 30 seconds answer also should be complete. So question 2, I will be telling you answer of this. First question 2. What do you mean by implicit memory? Your timer has already started, huh?
Sir, declarative memory.
Just why you are telling just other name? See, when somebody acquires skills, so this type of memory is procedural or non-declarative or implicit memory. And what is implicit memory? It does not involve awareness and it does not involve processing. At least you should have mentioned that it does not involve awareness. Okay, so these are again straightforward questions where there. This is again from your, in all books it is mentioned. So, scorer.
So at the end of round 2, we have the leading team as Team E, Ames Kalyani with 35 points. Next we have Team B, BJMC Pune with 25 points. Next we have Team C, Ames Rishikesh with 15 points. Team B, Ames Rishikesh with 10 points, and Team A, GMC Surat have not started yet.
Audience ready? Huh?
आपके पास है, सबके पास पेन है?
पेन सबको दिया है, कैलकुलेटर भी दे दो। नहीं, कैलकुलेटर recording are side by side below. At one time they are recorded. There are specific views. All this last question. One minute is there, 1 minute was there. You were having the option of googling also. So let us see who is. I would request Ruchi ma'am to come and felicitate our audience round winner. Now we will move to third round by Dr. Rekha madam.
MESH, UDGI, GI,
Teams, are you ready for the calculation round? Now this time we start from the A team. A, B, C.
Keep quiet.
Very fastly, I will tell you the general information and rules. While answering, unit is must. Also take care of positive or negative sign. Calculator will be provided. If log of any value, if you want it, then it will be told. Maximum 20 points. Right answer 10 points. Steps and formula of calculation 10 points. If you give only the answer and your steps and the formula is wrong, then we are not giving marks. Okay? So for answer only 10 marks and steps and the formula 10 points. Okay. Total time duration here is 2 minutes. Okay? And passing is permitted. If team does not answer anything or say pass, for passing no extra time will be allotted. Okay? For pass question, maximum 10 points will be awarded. Part solution 0. No negative marking. So please note, time is 2 minutes and passing is allowed in this round. Okay? So we start from team A.
See, passing is permitted only if you don't utter anything. अगर आप कुछ भी A भी बोल दिया तो भी it is not permitted. Okay? And second should be ready. Instantly you have to give the answer. Both question 1 as well as question 2. I mean to say answer as well as steps. If you are not telling anything correctly, then you are also getting 0.
सिंगल पास है कि दूसरा भी पास है?
Only single.
Single pass.
We will just wait for 2 minutes. Calculators are coming.
मेरे रूम से कैलकुलेटर लाया था मोबाइल का एक ही चाबी मुझे
मोबाइल पे दे दो मेरे को। एक ही पाइप चाहिए ना, बाकी 4 है क्या?
नहीं एक ही चाहिए।
अच्छा तो ये यूज़ कर सकते हो
मोबाइल पे फिर वो दूसरा यूज़ कर सकते हैं।
ऑब्जर्व यूज करेंगे,
अभी बात से शुरू करेंगे।
हाँ बस आ ही रहा है, जस्ट 2 मिनट्स।
ठीक है, till the time you can use mobile.
लाया? हाँ लाया।
ठीक है।
8 team है. You have to pass on, okay?
So team A, your question. Start. Team A, question for you. Calculate alveolar ventilation from a given data. Tidal volume 500 ml. Please write down this thing. Breathing rate 15 breaths per minute. The PCO2 of arterial blood is 40 mmHg. PCO2 of expired air is 30 mmHg. Your time starts now.
Two minutes are there, okay? 1 minute has already started. दो मिनट 2 minutes.
But what's the timing for that? It's only 1 hour, right?
Second minute is started. Please be fast. Team A, only 15 seconds left. Your time up. Team B. No, it's a
No passing now.
no passing.
Go to second.
So answer is 5.625. This is the calculation. Alveolar ventilation. Alveolar ventilation is equal to tidal volume minus dead space into breathing rate. According to Bohr's equation, inspired air is the ignored and dead space is equal to tidal volume into PaCO2 minus PeCO2 divided by PaCO2. So answer is 125 ml. So alveolar ventilation is 500 minus 125 into 15. So it is 5.625 liters. So team A 0.
Pass on calculator.
No wonder they're giving.
Team B, question for you. Calculate net absorption of creatinine from the given data. GFR 60 ml per minute, urine flow 2 ml per minute. Please note down this. Creatinine concentration in urine 10 mg per ml. Creatinine concentration in plasma 2 mg per ml.
Just multiply both.
Your time start now.
Don't.
This. Then you should have participated. I am saying to you.
Team B said pass.
Something.
1 minute completed. Second minute start. Please be fast. Only 30 seconds. Team B, be fast. Time is running out. Your time is up.
50 ml per minute, because first we calculate the clearance of creatinine.
Wrong answer. Audience, anyone want to answer?
Yes, calculated.
Yes, 100 unit
Milligrams per
mg. So what is the formula?
Like GFR into creatinine concentration in plasma minus urine flow into creatinine concentration in urine.
GFR into creatinine concentration in
Plasma.
plasma. So this is amount filtered
Filtered.
and
And amount
Excreted.
is equal to urine flow rate into creatinine concentration in urine.
correct.
Which is subtracted.
Good. Please clap for him. Team C, question for you. Okay, first I will tell the solution. So this is the solution. Team C, are you ready? So here's your question. Calculate the resting membrane potential across membrane from a given data. The semi-permeable membrane is separating ICF intracellular fluid from extracellular fluid, and each chamber contains ion X and ion Y. Concentration of X in ICF is 100 milliequivalent per liter. Concentration of X in ECF is 10 milliequivalent per liter. Concentration of Y in ICF is 20 milliequivalent per liter. Concentration of Y in ECF is 200 milliequivalent per liter. Permeability of X is 10 times of Y. Your time starts. One minute is passed and second starts. Seconds left. Uh, 0.53. Be fast.
32.33 millivolts.
32.33
millivolts.
It is 32. And what is the sign? Positive, negative. What is it?
Negative.
Okay. So what's the final answer?
Minus 32.33 millivolts.
Okay. It is minus 32.5 millivolt, but it's okay. Tell the formula.
Okay. So the formula is minus of 61.5 log of permeability x का concentration outside upon plus permeability of y into concentration of y outside upon permeability of x inside plus permeability of y inside.
Correct. So tell. Team B ready?
This round is for 20 marks.
20 marks है ना ये?
हाँ 10 plus 10. 10 plus 10.
10 plus 10. 10 for the correct answer, 10 for the formula and the step. So this is the solution, this is the formula. Goldman-Hodgkin-Katz equation. And the solution is. So, Team D, are you ready? Ready? So here's your question. Calculate the conduction velocity in meter per second of the median nerve segment proximal to distal from the given data. Muscle action potential duration, distal stimulation is 8 millisecond. Muscle action potential duration, proximal stimulation 8.4 millisecond. Latent period when a nerve is stimulated at a distal point 3 millisecond. Latent period when the nerve is stimulated at the proximal point 7 millisecond. So your time starts now. And this okay, distance between proximal and distal point is 10 centimeter. Your time starts now. Second minute. Be fast, Team D. 30 seconds are left. Yes.
The answer is around 2.12 centimeter per millisecond.
No. Tell the formula instead.
And so while calculating the velocity, we used the distance between the 2 points divided by the muscle action potential during the proximal stimulation plus the latent period, proximal minus muscle action potential duration distance plus.
No. Incorrect. It is the distance divided by difference in latent period. So that is the distance is the 10 centimeter and the latent period 7 and 3. So 7 minus 3, that is the 4. So conduction velocity is the distance by difference in the latent period. So it is the 25 meter per second. So it's very simple.
Very simple.
You have calculated that muscle stimulation, not the latent. Okay. Amy? Can we start? So, calculate cardiac output from a given data. Amount of indicator injected 4 milligram, heart rate 66 beats per minute, time for the first pass 40 seconds, average concentration of indicators 2 milligram per liter at the end of first pass. So your time starts now. Second minute start. Second left.
And 3 liters per minute.
Correct. Formula.
First of all, the average concentration that was injected, the amount of indicator that was injected was 4 milligram, and the average concentration was 2 milligram per liter. So if in 1 liter 2 milligram is present, then for 4 milligram 2 liters will be present, and this is we are calculating for 40 seconds. If we have to calculate the cardiac output in 60 seconds, it will be 2 divided by 40 into 60.
Correct. 20 points. So please score.
So at the end of round 3, we have the leading team as Team E Ames Kalyani with 55 points. Next we have Team C Ames Rishikesh with 35 points. Next we have Team B BGMC Pune with 25 points. Team D Ames Rishikesh with 10 points and the Team A GMC Surat with 0 points.
ऑडियंस की बारी आ गई है फिर से. बी रेडी विथ योर मोबाइल. कैलकुलेशन इज गोइंग टू स्टार्ट नाउ. request Rekha ma'am to felicitate Vishnu.
Ma'am.
So now we come to the audio visual round. This will be quite exciting. ठीक है, calculations के बाद it will give you something to enjoy. So the rules are, the picture or the video would be displayed or interesting facts would be told. Please be attentive, team C. Followed by 2 sub questions. Maximum there are 20 points with 2 sub questions. For each question 10 marks, right? And if you are unable to answer first sub question, then answer would be given if next question is related and the next question would be asked, right? So score is that would be awarded will be either 0 or 10 for each sub question. So you will be getting half, that is 10 if only one part is right. And 30 seconds for each sub question, and there is no negative marking and no passing. Ready? We want to start with team E. Team E. Okay. Ready, team E?
rate of lung damage has increased rapidly. Problem is we don't have many AB negative donors. कितना महीने रहना है? 5 से 6. श्रेया को गले लगाए रखने के और भी तरीके हैं कबीर. I know we miss her a lot, but Dada, I don't want to die.
जब किसी पेरेंट को ये पता चलता है कि उसके बच्चे का फ्यूचर दांव पे है, तो वो उसके लिए कुछ भी कर सकता है. जरूरत पड़े तो वो एक एनिमल और मॉन्स्टर भी बन सकता है. जोश के लिए मैं कुछ नहीं कर सकता हूँ. एक क्रिमिनल को मारने के लिए कभी कभी खुद एक क्रिमिनल बनना पड़ता है. मुंबई के ऑर्गन डोनर्स की जरूरत चाहिए. एबी नेगेटिव ऑर्गन डोनर्स के मर्डर हो रहे हैं.
So this clip is from the web series where the father tries every measure to save his kid who is ABRH negative, who needs a lung transplant. So your question is, in organ donation and blood transfusion, matching of the blood group plays an important role in addition to various other investigations. So what do you mean by major cross match? Teamy.
Ma'am, in the major cross match, we match the antigens which is present in the plasma of the donor and the antibodies which are present in the plasma of the recipient in order to avoid agglutination of the red blood cells of the donor.
You wish to say that the antigen is on the
Donor. Donor RBCs.
Okay. Your second question is why donor's plasma may be ignored in cross-matching?
Because there will be dilution, so the concentration of the antibodies will not be much, so there will be not much agglutination.
So we give full point to team E. Both the answers are right. So major cross-matching is matching of the donor's RBC against the recipient's plasma, and as the donor's antibodies are neutralized by the agglutinogen in the recipient's body fluid, therefore it is not acknowledged that much. Now coming to next team B. This is the clip.
In America, it's here. You could be anything, you could do anything. I'm the wrong person to have discovered this.
You don't speak for them. Who will?
I found a disease that no one has ever seen. Repetitive head trauma chokes the brain. The NFL does not want to talk to you. You turned on the lights and gave their biggest boogeyman a name. You're going to war with a corporation that owns the day of the week. No proof was presented today because there simply isn't any. They have to listen to us. This is bigger than they are. What do you think they're doing to you now? That's nothing. You have no idea how bad this could get. I have to keep going. They want you to say,
Okay, this was the clip. So this clip is from movie Concussion, where the impact of repeated head trauma in contact sports on brain function is picturized. And your question is, what is enterograde amnesia? The time starts.
anterograde transmission is transmission from the neuron back to the synaptic terminus, like in the opposite direction.
Amnesia, not transmission. It is anterograde amnesia. Yeah. Okay. So coming to the next question. Name the amnesia is loss of memory, right? So name the structure that is predominantly damaged in anterograde amnesia. You have to name the structure, not the lobe.
Prefrontal cortex.
Not the lobe.
Okay, sorry. Ma'am, the hippocampus.
Can't even marks. पहले आप हिप्पोकैम्पस बोलेंगे फिर नो
मैंने स्पेसिफिकली बोला था कि इट इज दी
द आंसर वाज हिप्पोकैम्पस. आपको फर्स्ट टाइम बोलना.
Yes.
So, guy clear cut not.
या सॉरी. ठीक है. You have to answer the exact thing which is being asked, right? Okay. Pass on the mic to next team. Coming to third clip for team C.
The boundary troop. Nothing goes 10 to 9, 6 is in my hand for the field of the lifeline. Just enough bats. The skill of Rishabh Pant to use space and to down the boundaries, quite evident. Offside.
Question is, this was the clipping of Rishabh Pant, who met with a terrible accident due to which he was out of action, but he returned with a bang, giving his best. I won't wonder if the movie is picturized of him. The question is, if any part is not used for long duration, that part shows structural changes. A similar is observed in the cortex. To be precise, connections are never innate, they get modified based on experience. What is this phenomenon known as? Yeah. You have to name the exact phenomena. What is this?
Disuse atrophy.
Okay, moving to the next question. What is sensitization, which is one of the mechanisms playing a role in the above phenomenon?
Facilitation of the synapses. So this is positive memory. So the actions that we keep repeating, so the synaptic transmission keeps on getting faster, and the memory gets converted. Short-term memory gets converted into long-term memory.
Answer is time.
Positive memory. That's all.
Anyone from the audience who would like to?
Branching of the dendritic spines increases. Number of transmitter vesicles increases.
And this you are telling us about the memory, how it is enhanced.
With facilitation also.
Less form of learning.
Paired with present or unpresent. When it's that question was very. Judges, can you give marks for?
In place form of learning, Pairing of stimulus.
So the phenomena earlier was plasticity, synaptic or the cortical plasticity, right? And the other one has already been answered, right? So moving to next team, please pass on the mic to team B.
सर तो रबड़ भी नहीं करते आज अचानक इतनी चाहिए क्या है ऊपर से बजाया तो डम डम डमरू नीचे से बजाया तो फटा हुआ ढोल फिर डबल ढोल की कहाँ से लाया है
This clip is from movie Pushpa, where the inspector applies the act of percussion to guess the content. Okay, the question is, a 36-year-old male patient with a respiratory complaint was found to have a stony dull note on percussion of the right side from second intercostal to eighth intercostal space in mid-clavicular line. What would be the content below this stony dull note? Your time starts.
Wait.
Time up.
Pulmonary fibrosis.
It's wrong. Coming to sir इसके बाद. Next question. Tell any two differences between vesicular and bronchial breath sounds. Your time has started.
Ma'am, the vesicular sound has no gap between the inspiratory and expiratory sounds. Also, the bronchial sound is is smooth and louder note is heard, where vesicular sound.
So for bronchial sound, the blowing like sound is heard, and for vesicular it is rustling like leaves.
But your first partner was confusing both together. So anyone from the audience, the previous question का answer करोगे? Wow, what was the cause for stony dullness from intercostal space second to eighth? Very good. It is pleural effusion. Okay. So they get 10 marks, right? So coming to team A, 0 plus 10.
Great, I'm so happy with the results. And you should be too. What's the problem?
Happy? You want me to be happy?
Hey, I just had sex with a robot. तो इतना हाइपर क्यों हो रहा है? What? It's just a one night stand.
No, it's not, Masi. मुझे लगा हम लोगों के बीच में कुछ connection था. Turned out to be a cool.
अच्छा रिलैक्स कर प्लीज
सिफरा मुझे किस करेगी ये भी कमांड आप ही ने उसके अंदर प्रोग्राम किया था
मैंने ऐसा कोई कमांड नहीं किया
तो फिर कैसे हो गया
सिफरा चेहरे के एक्सप्रेशंस को स्टैबिलाइज कर सकती है यानी कि एक तरह से रेड कर सकती है और ऊपर से तो उसका आइटम भी था उसने तेरे चेहरे पर लगना किसके ऑर्डर कर दिया होगा शी डिड इट बिकॉज़ यू वांटेड गेट इट
from movie तेरी बातों में ऐसा जादू किया. A robot उलझा दिया. Okay. A robot is trained to read facial expressions to an extent that the actor fails to identify that it is a robot. So the question is, tell the peculiar disorder known for expressionless face. You have to tell the disorder. No murmuring, please.
Timer.
Bell's palsy.
No. एक ही को देना है ना. This is wrong. Next question. Tell the function of caudate circuit in basal ganglion. Be very specific.
Cognitive function.
Okay. So this one is correct. Anyone from the audience for the first question? Parkinson's disease. 0 plus 10.
So at the end of round 4, we have Team E Ames Kalyani leading with 75 points. Next we have Team B BGMC Pune and Team C Ames Rishikesh with tight competition with each other, 35 points each. Next we have Team A GMC Surat and Team D Ames Rishikesh, both are having 10 points each.
Audience ready? So we are going to start. Your internet connection should be proper now. Questions are asked to him, but he is answering anything. Question 2. Question. Take your time and answer. Don't be in a hurry to answer. Let us see who is the winner. So I will call Ruchi ma'am to felicitate the winner.
Second award. Already has
आता ठीक है ना, इट्स मोर अट्रैक्टिव दे सकते
Are teams ready for the fifth round? Yes. Just be relaxed. It's a bit easier round. Okay. Let's go through the rules fast. So for this round, the case history will be displayed and maximum 20 points. There are two sub questions, 10 marks for each question. Sub question 1 is related to diagnosis. A clinical problem is given and you have to diagnose and you have to justify the clues which have given you clue to reach the diagnosis. If you just diagnose and not able to explain it, justify it, you will get 0 marks. So keep it in mind, okay? If the team is unable to answer, then the answer would be given. Okay? In treatment part, the drug name is not important, but the physiological basis of the treatment, non-pharmacological treatment also you can say, okay? In sub-question 2, which is related sub-question, would be asked and complete answer is required. That means you have to justify your answer. Complete answer, 10 marks, and if the answer is incomplete, you will get 0 marks, okay? 30 seconds for each question, and there is no negative marking and no passing is allowed. The rules are clear, all the participants. Team A, ready? So, like this, you will get, what is this? Can you? Yes? Dekha hai? This is not the question, let's go move to question. First question is, for team A, please concentrate. A 32-year-old female, strict vegetarian, visited the clinic with the complaint of generalized weakness, easy fatigability, loss of appetite and numbness since last 3 months. On further inquiry, her menstrual history was normal. On examination, pallor was present. Other examinations were normal. Sensory system examination revealed loss of fine touch, position and vibration on lower and upper limbs. Other systemic examinations were normal. He was advised on hemoglobin and peripheral smear examination. The hemoglobin was 10 gram% and peripheral smear examination. Picture is this. The second one is the picture in the peripheral smear. Now the question is, identify the condition and justify. And your time starts now. Quick, be quick. Name the condition first. What is the condition? And time up. Time up. It was very easy. Yes, audience. Yes. Megaloblastic anemia. Yes.
The finding on the slide.
Yes.
Large RBC.
Large RBCs and multilobe nucleus, neutrophil. The nucleus of neutrophil is multilobe and large RBC. Other picture like was there in the clinical presentation. Now come for the second question, I have told you the diagnosis. Okay, so you will get 0 marks for first question. The second question is what is the physiological basis of treatment and justify your answer.
Ma'am, intravenous injection of vitamin B12 and folic acid.
Okay. Justify.
Ma'am, this will
How it is important?
ma'am, because megaloblastic anemia is basically due to deficiency of the vitamin B12 and the folic acid. Because antibodies are created against the calcium intrinsic factor for the absorption of vitamin B12.
How it will help justify? The answer is income. What is the role of B12 in synthesis of hemoglobin?
Ma'am, it helps in the synthesis of DNA, genetic material.
Specific answer you are not giving. Sir, can you give?
DNA बोल दिया.
Sir, but DNA they have not uttered the word key factor, saturation factor, how B12 folic acid depends on each other. That was must.
The role of B12 and folic acid in DNA synthesis. That you have to tell. Okay. So judges, whether we will give this.
DNA बोला. He uttered the DNA.
Okay. Okay, so you will get 10 marks for the second question. Okay. The correct answer was megaloblastic anemia and B12 and folic acid. So in this you can say these are the maturation factors which are important for the synthesis of DNA cycle. So the next question for team B. Ready, team B? A 44-year-old male patient, a chronic alcoholic since 11 years, came with the complaint of yellowness of eyes and generalized distension of the abdomen, which progressively increased over 1 month. The patient is also having similar episode in the past. He was advised blood investigation, whose results are shown below. Total bilirubin is 10 milligram per dl. Direct bilirubin 6 milligram per dl. Indirect bilirubin 4 milligram per dl. Urobilinogen is decreased. Urine color is dark. And urine bilirubin is present. Stool color is normal and alkaline phosphatase is mildly increased, but SGOT, SGPT are markedly increased. So these are the laboratory findings. Now the question for team B. Patient is suffering from which type of jaundice? Justify your answer.
Hepatic jaundice?
Yes. Justify.
Because the direct as well as the indirect type of bilirubins are increased, therefore we can say which are both are above the normal level. So they suggest the mild obstruction also and mild hepatic dysfunction also. So we can say that it is a hepatic.
Another key point is
the reduction in the value of urobilinogen also tells about the hepatic.
yes. So correct answer 10 marks. The second question for team B. Which type of jaundice is known as echoliuric jaundice and why? Time is running fast.
It is prehepatic jaundice.
Yes, justify.
Because choleric means that the products which the products are there, they have to be excreted in the urine, which mainly occurs in the obstructive jaundice since the feces pathway is blocked. But in case of prehepatic jaundice, the overload of bilirubin conjugation that causes the jaundice, and the excretion for the conjugated bilirubin pathway is open. So the urine, so it will not be excreted into the urine.
Why?
Right. Key point is missing. You can add keyword.
The bilirubin is not entering the liver, so it is not undergoing conjugation. So it will.
One word is important. That is
Why?
time up.
But we have answering. This is what.
So it is the first answer is correct. Hepatocellular jaundice because of one keyword you missed, like increase SGOT, SGPT. The prehepatic jaundice, this type predominantly due to unconjugated bilirubin is increased. Yeah, आपने बताया, but it is protein bound, so cannot be excreted. This is important. This bilirubin is protein bound. That justification. Okay. So whether second not give mark. So 10 plus 0. Team C. Next question is for Team C. This is the clinical problem. A 56-year-old known case of diabetes and hypertension came with a complaint of disturbed walking and altered speech in the last 1 month. On neurological examination, drunken gait, dysdiadochokinesia, intention tremor were found. Further, knee heel test and Romberg signs are also present. So the question is, identify the condition and justify.
Diabetic neuropathy.
Answer is wrong. Dysdiadochokinesia. When you get the drunken gait, okay, it is cerebellar dysfunction. Okay.
Not what?
Cerebellum. Okay. So it's fine, but you have still chance to answer the second question. Okay. Second question for you is, in addition, it was found that symptoms and signs are predominantly to the right side. Which side of this particular region is involved? Justify.
Right cerebellar hemisphere, because the spinocerebellar tracts travel ipsilaterally and no crossing of fiber occurs.
Okay. Correct answer.
Incorrect.
No, not correct. It is incomplete. You can complete your answer. Still have time. You can complete your answer. Justify. Complete.
Lateral side of the cerebellar hemisphere, because
Justify.
spinocerebellar tracts do not cross.
Let's see the correct answer. First answer was cerebellar lesion. Because of that, all the clues were there. Drunken gait, dysdiadochokinesia, intention tremor. Intention tremor is specific for cerebellar lesion. And Romberg sign also. The side involved is same side, that is right side, and the reason behind this is double decussation, because the cerebellum of right side is related with the cerebrum of left side. So there is double decussation. That's why it is right side. Okay. Okay, so this is double leakage. Now sorry. So the marks for team C is 0 plus 0. Now team D, are you ready? Clinical problem for you is a 33-year-old male came with the complaint of easy fatigability, weight gain from 1 month. There is a history of decreased appetite, constipation and intolerance to cold. There is no history of diabetes and hypertension. General examination revealed no pallor, but edema is present, which is of non-pitting type. In neurological examination, delayed knee reflex was found. Okay? The first question with this clinical problem is, what is the cause of these symptoms? Justify your answer.
The condition is hypothyroidism, and here the excitability of the neuron is decreased. Because of that, there is delayed knee reflex, and the basal metabolic rate is decreased, and because of that, there is decreased appetite. And what were the others?
Okay.
And that's why there is intolerance to cold.
That's correct. Yes, weight gain and all. So first answer correct, 10 marks. Now the second question. Confirm the diagnosis. The patient underwent a hormonal assay, T3, T4, TSH, and TRH levels. These all levels are decreased than normal. What is the site of the lesion? Justify.
The site of lesion is in the hypothalamus, and that's where the TRH level is decreased. As the TRH level is decreased, there is no stimulation of the pituitary gland. That's why TSH is decreased. And as there is no stimulation of thyroid gland, therefore T3 and T4
correct,
also
10 marks. Now the last question. 10 plus. Marks for team D, 10 plus 10.
Tertiary word.
Now 10, team E, are you ready? Answer already. Clinical problem for you is a 66-year-old patient, so ABC, who is known hypertensive, came with a complaint of chest pain which was radiating to the left shoulder since last 1 hour. He further had history of palpitation and dizziness. On examination, heart rate 120 beats per minute and blood pressure was 100 by 80 millimeter of mercury. Other examination findings were normal. ECG findings in precordial leads is shown. This is the picture of ECG. So the question for you is, diagnose the condition and justify.
And the condition is myocardial infarction. And because in the ECG there was ST segment elevation, and previously also the radiating pain was towards the left arm. So that
correct, 10 marks for question 1. Question 2, ready? Just justify the physiological basis of how would you treat the patient. Any two treatment modality suggest.
And first, if we want to treat it non-pharmacologically, then we will tell the patient to rest so that the collateral circulation can develop. And apart from that, if you want to remove the block, we can place a stent or we can do coronary artery bypass grafting.
Okay, correct. Both the answers correct. 10 marks. 10 plus 10. The answer. Rest, as you mentioned, apart from it, beta blockers, vasodilators, thrombolytic agents can be tried. And if there is a CVD, then the bypass can be.
Don't go directly to the bypass. Have a treatment.
Physiological
Treatment.
Now, you will not participate.
अरे नहीं ना, करने दो, कर सकते हैं, हाँ?
Middle will be given to the next week.
सेकंड वाले को देंगे.
Okay, ready. This is second round. Only two certificates and 2 medals are remaining now for audience. Okay, we are going to start. Want to take a natural break with that? Second question. Read and answer. See and answer. Last question. So let us see who is the winner now. Done. Now, second time in a row, here is Miss. Yes, I think we have to felicitate Yuvika.
आगे जी. मैम.
So here we start the sixth round, that is the transduction or signaling mechanism, one of the core crux of the physiology, where we learn about the signal transduction and the signaling. So I will highlight the rules. So these are the rules. Some facts would be told, followed by 2 sub-questions. Maximum points will be 20, with 2 sub-questions, each question carrying 10 points. If unable to answer first sub-question, if required, then answer would be given and next question would be asked. Okay. So the score awarded would be 0 or 10. So either it should be correct answer and the complete answer is must. And the time for this time to answer is about 30 seconds for each sub-question. There will be no negative marking and no passing. Okay. So we'll start from team E. Shall we start? Here is your question. various neurotransmitters act through various receptors, which determine the action of these neurotransmitters. These neurotransmitters are also called chemical messengers. And the first question is, when the chemical messenger is more in quantity relative to the number of receptors, the number of active receptors decreases. What it is called, and tell any one mechanism for it. Okay, your time starts now.
This is known as the down regulation of receptors, and it is done by the internalization of the receptors or by making the receptors inactive.
Okay, correct answer. Yes. So we'll move to the next question as the answer was prompt. So here come your next question. What is the action of norepinephrine via the alpha-1 receptor in male sex organ? The time starts now.
It helps in ejaculation.
Yeah, very good. Correct answer. So the next question is to the team D. So team D, are you ready? Here is your question. Receptor ligand interaction initiates cell response. Various second messengers are involved, which leads to the amplification of response. Various enzymes are involved in this response, in this process. These enzymes ultimately stimulate various proteins to produce various effects. So the question number 1 for team D is, tell any two calmodulin dependent protein kinases.
So one is MLCK. Any different other kinds of protein kinases like protein kinase.
Try to give the complete answer. The time is over. Okay. Only partial answer you have given. Okay. We'll move to the next question. Next question for team D is, tell the mechanism by which atrial natriuretic peptide acts.
The atrial natriuretic peptide helps in decreasing the BP, so it acts via the G receptors. And then there is production of CGMP, which causes vasodilation.
What is the
Nitric oxide is G protein, protein couple
correct
receptor.
answer. Good, correct answer. So for the team D, I think there should be only 10 marks because the first answer was incomplete. Okay. So we'll move to team C now. So here is the scenario for team C. Okay. G protein plays an important role in the translation of signals to cause biological effect. There are various types of small G proteins and heterotrimeric G proteins. Small G proteins are structurally related to alpha subunits of heterotrimeric G proteins. And the question for team C is, name various groups or families of small G proteins. At least two answers should.
Inhibitory and stimulatory, GS and GI. GI and GS.
Families.
Q and GS.
Question was groups or families of small g proteins. So try to answer before the time runs.
G
inhibitory proteins and G stimulatory proteins.
That is not the correct answer. Okay. So 0 for this answer. Here is the next question. Tell any two physiological functions of small g protein.
When any hormone acts on a cell, they may act through G protein coupled receptors, leading to activation of cyclic AMP, which leading to formation of cyclic AMP, which ultimately activates the protein kinase A, which can lead to changes in cell membrane permeability or ionotropic changes, and also action of enzymes and metabotropic changes. So it can change the metabolism of cell as well as its permeability.
Look at the question. Question was very specific, and this is not the correct answer. Okay. 0 marks. There are some answers. Team B. The next question for Team B. Are you ready, Team B? In the signaling mechanism, adenyl cyclase acts on ATP to form cyclic AMP, which in turn activates other protein kinases. Cyclic AMP also gets inactivated to cause termination of action, again associated with physiological function. So your question is here. Tell enzyme which cause conversion of cyclic AMP to 5-AMP.
5' phosphodiesterase.
Yeah, that is the correct answer. Phosphodiesterase enzyme. Next question. Team B here. Enumerate any two inhibitors of this enzyme.
Sildenafil,
Time is up. That was a partial answer. These are the answers for both questions. So they have answered the first question correctly. We'll give them 10 marks. Next question is for team A. Look at this diagram. This question will be based on this diagram. Okay. Shall we move to question? In the diagram, one of the mechanisms by which processing occurs in the visual pathway is shown. Diagram is the receptive field of retinal ganglion cell. And your question is here. When light falls in the center, what response will be seen in the center and the surroundings?
The central retinal cells would be activated and inhibition of the peripheral cell.
Central retinal cells will be
activated and periphery में inhibited.
Yes, that's the correct answer. So center, when light falls on the center, there is increased firing from the cells, and surrounding will be inhibited. Next question for team A. Yes. What is the mechanism for the above phenomenon? The time starts now.
Sir, when light falls on the cell, 11/6 retinal is converted into 11/6 retinal is converted into all translucent. So depolarization would happen because of opening of sodium channels.
You can simply label the mechanism instead of describing.
So transduction would be there.
No, that is not the correct answer. So this is the response. This is the answer for second question. Lateral inhibition and center surround antagonism. That was the correct answer. So 10 points for team A and 0 question B. That all about the signal transduction mechanism round. Thank you.
Last audience round. Last round. The audience be ready. Whatever question you have come across till now, all were the important Viva questions. That is where we are insisting that you should attend the quiz. So we are going to start 40 as limit. क्योंकि आइडियल लिमिट है लेकिन वो आ जाता सॉफ्टवेयर का कुछ ना last question for audience. Who is the winner? Dr. Avinash to felicitate winner. from the score line, it is very clear that who is the winner. Now there is a competition for second, third, fourth, and fifth position. But first position, they can still make their position much stronger. Here it is maximum 50 points you can score. But here see, there are 10 questions are there, 5 points for correct answer. Out of these 10 questions, 7 are true or false, and 3 are one word answer or fill in the blanks. So pass question, if you are telling a pass, for that you will be getting 0 marks. Here total time is 90 seconds and you are supposed to answer loudly and clearly. Okay. So what would be my suggestion is, first you decide who is going to answer. Okay. We are given you one cheat. In the cheat you have to just pay attention to which is the pass. Because if 90 seconds, if time is remaining, we will be coming back to that question. You have to tell for which question number you have tell pass. Right? I think we are starting with team A.
Make clear about the
My sound is clear.
Yes, sir.
So Shashidharan will say ready to team A, then he will say ready to team A, and I will start them. Ready?
Yes, sir.
Hypoxia would cause vasodilation in pulmonary blood vessel. True or false?
Pass.
When muscle contracts, length of the A band remain constant.
True.
Correct. Tonic labyrinthine reflex are integrated in medulla.
Pass.
Conduction rate in sinoatrial node is highest.
True.
Incorrect. Lung compliance is decreased in emphysema.
Pass.
T4 is more potent compared to T3.
False.
Correct. Enzyme in mouth digest only carbohydrate.
False.
Correct. Voltage gated potassium channel work in fill in the blanks feedback mechanism.
Positive feedback.
Correct. Any one area which lacks blood-brain barrier.
Ida posterior.
Correct. Number of OHA at the time of puberty.
Pass.
Well, past question which I can ask you.
First question, sir.
Hypoxia would cause vasodilation in pulmonary blood vessel.
True.
Incorrect.
Third question, sir.
Tonic labyrinthine reflex are integrated in medulla. Time up. You are having one more incorrect. Mistakenly voltage gated potassium channel you have told positive. It is not positive. So one more incorrect. Okay. So what is their score? Tell. How many correct? How many incorrect? So score 25. 21. Okay. So right. Are you correct? You can write there. Team B ready? Who is going to answer? Shashidhar, I am waiting for your command. Ready? Gain of any system signifies the time to act. High gain system are rapid to act. Incorrect. Tonicity and osmolarity are different terms. Pass. End plate potential is graded potential, but still it is always positive.
Pass.
Pass. Primary motor cortex contribute to about 80% to corticospinal tract.
False.
Correct. In lead AVR, T wave is always recorded as inverted.
Pass.
Pass or
Pass.
if FV given by FVC ratio is normal, then there is no chance of any type of lung disease.
False.
Correct. Glucose infusion will cause inhibition of glucagon secretion.
True.
Correct. When semen analysis shows zero sperm count, it is called
First one.
incorrect. Counter irritation by massage cause modulation of pain transmission. Name theory. Counter irritation by massaging causes modulation of pain transmission. Name theory.
Gate control.
Correct. Salivary amylase enzyme hydrolyze fill in the blanks linkage in starch.
Alpha 1,4.
Repeat.
Alpha 1,4. Glycosidic link.
Okay, right, correct. Correct, how many? Correct. 21. Team C ready?
Yes.
Shashidharan waiting. Your
Is he
command.
ready?
Total body water percentage in female is less in male, assuming both have same anthropometric parameter.
True.
Correct. Non-constitutive pathway is also called as regulated pathway.
True.
Correct. In 28-day cycle, cervical mucus stretchability would be maximum at 28 days.
Pass.
Pass. Fasciculation are the feature of UMN lesion.
True.
Incorrect. In cardiac cycle, diastasis phase is having longest duration.
True.
Correct. Cholagogues are the substance which increase secretion of bile acid.
True.
Incorrect. Oral glucose and IV glucose of same amount would cause same increase in insulin secretion.
False.
Correct. Synaptic connections are not permanent, they change with past experience. This phenomenon is called
Pass.
receptor present in sarcoplasmic reticulum is
Thymidine receptor.
correct. If tidal volume is 600 ml, dead space is 100 ml, respiratory rate is 10 breaths per minute, then minute ventilation would be
5 liters per minute.
false. Correct. Incorrect. Pass question.
Pass.
Third, in 28-day cycle, cervical mucus stretchability is highest on 28th day. No. How many correct? How many
5
incorrect?
correct and 3 incorrect, so 19.
You ready? I'm ready.
Team D ready?
Yeah.
Plasma volume can be measured by chromium labeled RBC.
Pass.
In XX genotype, if ovary is absent due to any cause, genitalia developed will be of male type. If in XX genotype, if ovary is absent due to any cause, genitalia developed will be male type.
True.
Incorrect. Term positive chronotropic means increased heart rate.
True.
Correct. Hypoxia would cause vasodilation in pulmonary blood vessel.
False.
Correct. Glute channel work by facilitated diffusion.
True.
Correct. Oxygen depth and oxygen deficit are synonymous.
Pass.
Indirect and direct action of GH are similar or same in nature.
Pass.
Voltage gated sodium channel works in feedback mechanism. Fill in the blanks.
Pass.
Site of neuron where action potential propagates.
Axon.
False. Full form of Z in Z line is?
Pass.
Pass question.
First question.
Plasma glucose can be measured by chromium labeled RBC.
Pass.
You have to tell.
Fifth question.
6. Oxygen depth and oxygen deficit are synonymous.
False.
Correct. So, team 2. Last team. 4.
4 correct and 2 incorrect, so 16.
Inheritance of mitochondria is considered to be paternal.
False.
Correct. If cold water is instilled in ear, nystagmus will be on same side.
False.
Incorrect. Dominant hemisphere is also called as categorical hemisphere.
False.
Veins are also called as Wind-Kessel vessel.
False.
Correct. Erythropoietin is released by juxtaglomerular cell.
False.
Correct. Acidosis is predisposed to hypocalcemic tetany.
True.
Incorrect. Loop of Henle is also called as counter current exchanger. Incorrect. Any one peptide hormone released by ovary.
Pass.
Name the cytoskeleton with the largest diameter.
Microtubule.
Correct. Hydrogen ATPase works by which type of transport mechanism?
Counter transport. Active. Secondary active transport.
Be precise.
Secondary active transport.
Wrong. Primary active transport. If cold water is instilled in ear, nystagmus will be on same side. Dominant. Of Henle is multiplier, not exchange.
4 correct and 4 incorrect. So 12.
Can take a rest for 4-5 minutes while the results are coming. You can sit here. You can sit here. आप Please sit here only at your place.
Please
Teams,
come to
please
your
sit here. You can tell your first.
Yeah.
आप बना दोगे ना?
Actually harder, but one more thing. Kind of. Thanks for the charger. Perfect. I don't think. All right.
हेलो सर, काउंट का एक राउंड करा दो और है स्पेयर क्वेश्चन अब तक के लिए। बस का म्यूजिक हाँ अच्छा लगता है खाओ, काम कर रहे हैं उसी पे ना।
What happened? Other Arctic are the winner. PMC, and per second. Congratulations. Top five teams, top 51 were participated from all over India.
बंद कर दी। हाँ हाँ अच्छा प्रिंट आउट। भैया
प्रिंट आउट है इनके टीम के नाम का वगैरह सबको चाहिए होगा सारे का
सर उसको प्रेस रिलीज बना के हाँ सर का है ना
बाद में आएंगे क्या जब होने के बाद देंगे
हाँ ठीक है सर आए थे सर
अच्छा प्रॉब्लम आएगा फिर है ना ये तो प्रॉब्लम आएगी वीडियो में जाएगा कब से तो हम खा रहे थे वीडियो में गया होगा आपने तो हमने खाना ही नहीं खाया बोल देंगे हाँ खाना इसलिए गए नहीं ना आप लोग समझ रहे थे
Hence Kalyani is a winner in a second time in a row. Last time also Hence Kalyani was the winner.
बैठ जाओ
Good afternoon, everyone. On behalf of the head of the Department of Physiology and the organizing team, it's my pleasure to welcome our distinguished guests and our beloved students to the 5th edition of National Undergraduate Physiology Quiz Competition closing ceremony. My honor and privilege to welcome our Executive Director, Sir, Professor Dr. Ajay Singh, Sir. Our Dean Academics, Sir, Professor Dr. Rajneesh Joshi, Sir. I'd like to welcome our PDA, Colonel Ajit Kumar, Sir. Now I'd like to invite Professor Dr. Ajay Singh, Sir, the Executive Director, AIMS Bhopal, to address our students and give his insightful words and enlighten us.
Thank you very much. India Physiological Society.
Department of Physiology.
You are conducting
Yes, National Physiology.
Fifth time sir work.
हाँ?
This is the fifth time work.
This is the fifth. मुझे नहीं लगता मेरे बोलने का कुछ है वो सामने दिखाई
News Kalyan.
Election. Then followed by Team B from
BGM से पुणे.
Pune.
BJ Medical.
expression to each and everyone who has participated. Whether they are winner or they are not winner, that's not the important thing. The important, it really needs a courage to come forward and to speak like this. And whatever you have done, they will have got some extra knowledge, some extra courage, and in the future you will be more successful, and you will also be able to find out some areas, some some points on which you have to work more. That in the future the results will be something like which are not were not successful today, but next time must have got some clue that how you can be the winner. So always winning is not the problem. ने कहा भी है कि जहाँ पे आप यदि कभी आप हारते भी हैं तो आपके पास ऑप्शन है कि आप सकते हैं। जीत गए तो वो तो जीत ही गए, लेकिन हारने वाले ही के पास ऑप्शन होता है जी। मुझे पूरी उम्मीद है कि जो लोग विनर्स नहीं भी हुए लेकिन तब भी नजर इन 5 टीम के अलावा भी जो भी आपने किया होगा और उसमें लोगों ने किया।
Sir, I am happy to announce nearly 55 medical colleges participate.
55
And
is
out
a
of there,
very
there are 2
great-
screening rounds, and now these 5 teams are.
और एक ख्याल से कल्याणी राम जी से He's physiologist?
Yes.
Yes, sir. That's why they're medical. He's a very good friend of mine. Convey my regards. And Department of see why our students are not here.
They were 6.
Among these 5. Among these 5.
They qualified 2 rounds, sir, but 6 they came and they.
But all the best.
Now request our HOD, Physiology department, and all the faculty of Physiology department, other faculty of other departments come on to the stage. Tell the state our winners and the of undergraduate physiology. In the 5th position, Kotari Raj Singh of Government Medical College, Surat.
Oh my God.
Fourth position. Fourth position, Samriddhi Saxena, Gauri Inani, AIMS Rishikesh. Third position, Aditya Bandari, Nanya Aishwarya Patel, AIMS Rishikesh. Rishikesh Kaushik Thakur, DGMC Pune, second position. Vishal Sahu, Hardik Kumar Meher, first place, AIMS Kalyani.
Gas get very heat. Anything? Second year years how to prepare for physiological.
It was a very good experience because all the backlogs which I couldn't cover in my first year, I did it in second year. Like I couldn't complete Ganong in my first year, but this quiz provided me another opportunity so that I can prepare my foundation of physiology even stronger. I'm really thankful to these school for this opportunity.
Actually, in first year, we should not go for any shortcuts or notes because we have a lot of time. We should go for each and every standard book like Guyton, Gannon, Constance also is a very good book. I have followed Guyton, not Gannon and any other book, but I have followed Guyton. I have worshipped Guyton.
What you are making? Let's show me. Single journal. Don't worry, don't worry. दिखाइए क्या बना रहे हैं.
All the participants to come onto the stage for a group photograph.
देख लीजिए फिजियोलॉजी में रह के यदि आप हिस्टोलॉजी के डायग्राम बनाओगे फिजियोलॉजी का यही हाल होगा कि नहीं आएगी.
Audience speaker also can come.
Audience round winners. Audience round winners.
गोपाल हरिओम हरिओम मेडल के साथ आओ ऑडियंस हरिओम आ जाओ.
What's that?